Dana Burrows. I'm a physical therapist here at Tulsa Bone & Joint. After you have your joint replacement surgery, it is very important to get your range of motion. These exercises I'm going to go over with you today are to do just that. And we want to increase the bend of your knee and the straightness of your knee after surgery. So for this exercise, you're going to bend your knee slightly, and then you're going to slide your heel back towards your bottom, working on bending that as far as you can. Hold it a few seconds where you feel a stretch. It may be a little bit uncomfortable. That's okay. You don't want it to be painful. And then you'll straighten it back out to where it's all the way straight. And repeat. And that's how you perform the supine heel slide to increase knee flexion. Now I'm going to show you an exercise to work on bending the knee. So you need a chair where your foot can comfortably touch the floor. So this is a good one for you. Again, we're going to use the left leg as the replaced knee. So you're going to keep your foot on the floor. Then you are going to scoot yourself forward on the chair so that your knee bends, but try not to move the foot. There we go. So this, you should feel a stretch in your knee at this point. It's okay if it's a little uncomfortable. It should be a little uncomfortable as it's working on bending. And then you're going to hold this position for 2 minutes again. So this exercise is to get your knee straight after surgery. After surgery, one of the most important things is to make sure you get your full range of motion back. Our doctors like to have you have all the way straight and at least 90 degrees bent by the time you go back to see them. So this is an exercise you can do at home to get your knee all the way straight. We're going to do your left leg. So I need you to straighten your left leg all the way and put your heel on the floor. You're going to scoot out to the edge of the chair. Just like that. You may feel a stretch right here, but what we'll tell you to do is pull your toes back towards you. And then you're going to keep your chest lifted and lean forward at the waist to stretch those hamstring muscles on the back of your leg. There you go. You'll lean forward till you feel a stretch, and you're going to hold that position for 30 seconds. For this exercise, it's working on straightening the knee. It's very important in the first 3 weeks after surgery. It's really, really important that you do this every day, every hour, 2 minutes every hour. So you're going to sit in a chair. It can be a chair like this, it can be your couch, it can be your bed, and you're going to need something else like a chair or an ottoman or a table that you're going to put across from you. Just like this, and then we're going to put your left foot up on this, and you're going to let it stretch. Your leg's going to make a bridge between the two chairs. You're going to let gravity stretch you for 2 minutes at a time every hour that you're awake. Now I'm going to show you how to elevate your leg to control swelling after surgery. I'm going to have you lie down on your back. The left knee has had surgery. You're going to take some pillows from your home. If they're very flat, you may need a few. You're going to elevate the leg. You want your knee to be above the level of your heart and your ankle to be higher than that. There we go. So it's okay if the knee bends a little bit. The main thing is you want gravity to push that swelling back this way. So while you are elevating this leg, you can also perform some ankle exercises like ankle pumps. So you're going to take your foot forward and back like that. You can also do circles, clockwise and counterclockwise, and this just helps push that swelling away from that knee. You can perform this in your bed or on a couch, anywhere you can be comfortable, and that is how you are going to elevate your leg to help with swelling after surgery. Now I'm going to show you how to walk up the stairs and down the stairs using your walker. After you have your joint replacement, you will use a walker for a couple of weeks. Your home physical therapist or your doctor will help you transition off of that, but you will have a walker for at least 2 to 3 weeks. Your therapist in the hospital will show you how to walk with this, but today I'm going to show you how to walk up and down the stairs in case you have stairs at home or you have 1 or 2 stairs getting into the threshold of the home. Either way. Also, if you don't have a handrail already at home, it would be a good idea to get this installed before you have your surgery. This is always much easier if you have a handrail for safety. So, It doesn't matter which side it's on. If you have a handrail, use it, and you're gonna put your walker on the other side. So you're gonna bring it to here. So the handrail is gonna be on my left side. We're gonna pretend that my right leg is my surgery leg. So you turn your walker sideways. You're gonna put the walker up on the steps, so right at where the stair meets the next stair, so that it is stable. Always check your walker to make sure that it is stable by pushing on it before you go to step up. When you do stairs, you will always go up with your good leg and down with your surgery leg. So my right leg has had a knee replacement, so I'm gonna hold the handrail, hold the walker, and I'm gonna go up with my left leg and then bring my right leg up to it. So to go to the next step, you're gonna put the walker same spot up against where the stairs meet. It doesn't matter on the back side if it doesn't touch or if it is hanging off a little bit, because this is still going to be stable enough. So as long as that is right up against that, and you can kind of check that as you go. So same thing, you're gonna go up with the good, then bring the surgery leg up to it. Same thing here. And then when you get up to the top, you can do, there you go. Now we're gonna walk down the stairs. So my right knee has been replaced. So for going down, you will lead with your surgery leg. I know that sounds weird, but if I were to step down the other way, it places too much bend in that knee, and that is not going to be comfortable. So you go up with the good, you go down with the bad. So for the walker, with this type of landing, I would be reaching too far forward here, so I'm gonna keep this here, hand on the handrail, and you're gonna step down with your surgery leg. Just like that. Move the walker down. There we go. Then bring your walker back around and you're ready to go. Thank you for watching these exercises today. I hope they will be helpful for you to regain your range of motion after having your joint replacement surgery for your knee. As a reminder, it is very important to get your range of motion back as quick as you can after surgery. And the other important thing is making sure you are getting up and moving at least once an hour while you're awake. Our doctors prefer at least 100 steps an hour as long as you are up and moving. All of this information is included in your joint replacement notebook that you received before surgery. If you have any questions, look there or call your doctor's office.